Hello everyone, today we will talk about latent tuberculosis infection, a modern look, immunodiagnosis of tuberculosis in children, powers and solutions. Well, you can see at this picture the spectrum of tuberculosis from mycobacterial tuberculosis infection to active pulmonary tuberculosis. And you can see that we have a lot of spectrum. Mycobacterial tuberculosis infection, it is what happened in our body. The first mention of a condition similar to latent tuberculosis infection is in the article by Voskresensky on the sign of pre-tuberculosis and its relation to the nervous system dates to the beginning of the 20th century. Latent tuberculosis infection is defined as a state of persistent immune response caused by the presence of Mycobacterium tuberculosis antigen in the body, in the absence of clinical manifestation and other symptoms of the active form of tuberculosis. The vast majority of people with latent tuberculosis infection have no sign or symptoms of tuberculosis but are at risk of developing active tuberculosis, which can be prevented by timely detection and preventive treatment of the disease. It is trouble when latent form in another people by another age. The main method of TB detection, it is fluorography, immune diagnostic, and clinical. It is like sweating, loss of appetite, weight, cold for more than 2 weeks, chest pain, prolonged increasing in body temperature, and we can take a sputum microscopy or bacteriological method. The importance of various methods in the diagnostic of tuberculosis infection, you can see at this picture. It is like clinical symptoms, which we can see at this picture, radiological changes, sputum microscopy, experimentals, and so on. Pathogenesis. The term latent tuberculosis infection was used by Garamonov, Journal of Tuberculosis Problems. And it is like which infection, adult and children in contact with tuberculosis patient studying treatment, patient on dialysis, patient preparing for transplantation or blood transfusion, conditionally recommended, health care works, person who use drugs. Specific TB risk factor, epidemic, contact with a person with tuberculosis, contact with tuberculosis infected animals, medical biology, non-specific TB risk factors. It is like medical and biological, hyperergic sensitive to tuberculin, and age and gender. Young age, social is like alcoholism, drug addiction in parents. Homeless of children, stay of parents in place of deprivation of liberty. Cause of late diagnosis of TB in children. You can see this picture. Every second children is offended with tuberculosis in the phase of previous development. Disadvantage of tuberculin diagnosis, the ability to carry out of accurate different diagnosis of true infection with Mycobacterium tuberculosis and active tuberculosis process due to cross-sensitization of the body to the AG of Mycobacterium tuberculosis with the development of a positive reaction to the tuberculin test. Due to mandatory BCG vaccination, tuberculin sample of determining the infection rate or of relative importance. New immunological test, high sensitive and specificity, test should be accelerated, expensive, and stable. Diagnostic test, you can see the skin test, STB skin test, ELISpot, quantiferon TB, and so on. Immunodiagnostic, old is Mantox's test with 2TE, and new age-stimulated introduction interferon EGRA. Comparison of diagnosis and new diagnostic test. You can see at this picture, it is like skin test, quantiferon TB, tuberculin with 2TE, and so on. Immunodiagnostics earlier MAN2 test, now skin test. Conclusion, positive and questionable reaction to ATP are less common compared to tuberculin. High efficiency of tuberculosis detection, the transition to screening from the APR of children over 8 years of age has improved the quality of early TB diagnosis. There were no cases of omissions of locate form of TB when assessing the long-term result of the use of ATP for screening TB infection after they reached adolescence during fluorographic examination. Evolution of immunodiagnostic method. Screening mass immunodiagnostic. Children from 1 to 7 years old, MN2 test. Children from 8 to 17 years of age, a test with RTP or RTR1. And children under 7 years of age with a positive reaction to tuberculin for the first time with an increase in reaction, a proponents and hyperregic reaction to tuberculin. You can see the traditional X-ray examination. And if we have a positive skin test, we should do computer tomography. Screening algorithm for tuberculosis in children from 0 to 7 years old. It is like MAN2, and it can be positive or negative. And you can see at this picture what we can do if we have a positive analysis. Screening algorithm of tuberculosis in children from 8 to 17 years old. Algorithm of screening for tuberculosis of children from 50 to 17 with the help of VGA. Chest fluorography, and if we see something or don't see pathological change, you can see at this picture what we can do. Alternative method is blood test based on the release of gamma interferon by T lymphocyte. Chest X-ray, diagnosis in vitro, and so on. In case refusal of any immunological test, the written consent of the parents is egress of conduct an X-ray examination. Option for preventive treatment of 6 or 9 months of isoniazid or rifampicin isoniazid and so on. It is difficult to create a perfect test prediction the disease. Tuberculosis infection is a very dynamic process that, for elusive reason, can progress and regress, and even in the case of a disease that has begun, it can stop. After a negative test, an adverse event may occur that will lead to the progression to the infection. Any test should be done in dynamic because it is important to catch the reaction curve, but it is impossible to do the test monthly. Conclusions. The mental test having high sensitive and begin simple and low cost remains the most preferred method for detecting latent tuberculosis infection. EGRA, a simple and relatively low-cost DST skin test, and tuberculin diagnosis remains the only method for epidemiological studies. Thank you for attention.